Welcome to Hope in the Dose, the podcast where we explore breakthroughs and challenges in cell and gene therapies. I'm Louise Kearney, and today we're talking about something that could shape the future of patient care, expanding CAR-T therapy beyond oncology into new disease areas. Why is this important? CAR-T has transformed outcomes for patients with certain cancers, offering hope where there was none. Now we're starting to see its potential in autoimmune and other non-oncology indications, areas where patients often have limited options and live with chronic conditions that impact quality of life. Bringing these therapies to new populations could be life-changing, but it's not simple. These studies require new thinking, different sites, new departments, and complex logistics. Today, I'm joined by Erin and Rielle Giannino, delivery directors at Fortrea, to discuss what it takes to make this happen and how sites and sponsors can prepare, and why early planning is critical in this competitive space.
Hi, Rielle, and hi, Erin. Thank you for joining us today in this podcast.
Good morning.
Good morning. So, recently we discussed in another podcast on cell and gene therapy country and site selection in cell therapies that there can be difficulty in identifying sites for these kind of studies. What are your thoughts on the things that drive this difficulty?
What I've seen thus far with my experience and some of the limitations that the sites are having, it's not so much capacity. It is truly competing studies, or again, the nuances with non-oncology having to intertwine rheumatology and oncology. The experience there, I have seen some of our sites who don't have the phase 1 capabilities. So their sites we've put in current studies on back burner for phase 2, especially ex-US. It takes them almost a year to get all of their certifications. So that's some of the challenges that I've seen currently. Rielle, I don't know if you have anything to add.
Yeah, I think what I've also seen is that along with some of the capacity issue, site resourcing tends to be a main driver with the ability to expand cell therapy studies outside of oncology.
I think another thing we've seen is that perhaps sort of rheumatologists and the people that see some of the patients in these non-oncology spaces, they haven't really thought about doing CAR-T before, and so they'll need a little bit of help to get the connection with insight.
That is correct. I've actually experienced that recently where we had a very interested site. However, the rheumatologist has never conducted any type of research studies, especially phase 1, is not familiar with CAR-T and with the adverse events. So our expectation is that oncologists to be very hands-on. They actually ask for a little bit of a guidance or RACI, more or less, of understanding how much effort the oncologist needs to play into this with rheumatology, because again, their experience is a bit less than obviously what the oncologist sees and has conducted in the past.
So what I can hear so far from you guys is that these sites sometimes take a bit of time to set up. So starting early is going to be really key. Thinking about which of your sites will be able to do sort of a phase 1 type study and which ones might want to stay till phase 2. And also helping guide sites set up the framework they need to deliver these studies in maybe in an area they haven't worked in. Have you got any other solutions to broach some of the challenges we have in site ID and startup for these sites?
Louise, I think to your point is working early on with the sites or identification, having phone calls, whether it's from sponsor side, CRO side, more or less to spark that interest. Again, looking at local groups, looking at KOLs. These lead PIs drive a lot of the interest, especially in ex-US. So if you can get your leading PI to really understand what's required, it has helped mold the additional sites within each of those countries. So again, really to summarize, it's starting early, not expecting it to be like our normal oncology studies and those standardized timelines of site ID and IRB approval. It is making sure you plan that runway a little bit longer and understand there might be additional training, additional hand-holding to really help them communicate, because we definitely see some lack in sites communicating within, because they're just used to working silo. So again, just working out all of those kinks early on, but it does add time.
And Erin, just to go back to something you touched on earlier, and kind of touching on the needing to start early, it's really important when we're approaching sites to bring their departments together. So looking to bring both the rheumatology department and the oncology department together during those early conversations to help them navigate how they would deploy such a site at their institution if they don't already have the infrastructure in place. It's really important to help bring those departments together so that we can have a better outcome when we're trying to enroll patients at the institution.
Yes, completely agree.
And then I suppose when I see most of these studies, they normally start in a small area, so in 1 or 2 countries, and then as they broaden out, they move to other countries. Any things that you need to think to bear in mind when you're moving from that initial country that you're working in to outside of that region?
I think one of the bigger points you need to consider is, where do you want your global footprint to be? Thinking about where you want, where you may be able to have manufacturing capacity outside of the U.S. and some of the logistics of manufacturing outside of the U.S. And is your product coming from the U.S. and going outside? Do you have a facility in another country, and what are the requirements to get it from one country to another? So that's kind of one of the key factors, in addition to kind of where the patient population is driving. And Erin, I think you might be able to touch on some of the regulatory nuances that you've seen with your non-oncology CAR T studies.
Yes. So to add on to exactly what you're saying, we also understanding the footprint, having that idea of the footprint, but understanding as well, there are so many different nuances within each country, Europe, your Latin America. You have to think of all the different scenarios. So we've run into issues with import, export. Again, it's all the questions, because cell products are not, you can't really put a number on it. So what number do you place? And again, it may work for one country a certain way, but it is not necessarily going to work that same way for the other country. So really leaning in on your country specialist. They understand the different nuances when it pertains to, regulatory submissions, timelines, expectations, how the sites even work, what is allowed, who is going to work outside that black and white area, into the gray zone, what is not allowed with, again, specific countries, who's not going to bend the rules more or less. But I can say, being in this space here recently, the teams do need to push the envelope a bit. I've seen it. Again, we get uncomfortable. We're used to each of these countries with regulatory submissions. It takes X amount of days. And yes, the regulatory authorities, it's not the most simple process. And yet there are timelines, but they don't always adhere to those timelines. But push the envelope a bit. Just to circle back, even what Louise said earlier too, is having conversations with the agencies ahead of time to talk about your protocol. When you get RFIs, there are people to actually have discussions with, your lead PIs who can help drive with the agencies as well to answer some of those questions around your protocol to limit the timelines with the RFIs. And again, working with the sites. UK, for example, with one of my studies, we broke the mold. It was a given, going to be so many days. It was going to be 2026 before we activated them, and we were able to activate them 3 months earlier. Again, pushing the envelope a little bit, even with the site, having them be a bit uncomfortable with their normal process of R&D first and then pharmacy next. And they were able to work outside of that and move their processes a bit to be able to accomplish those timelines. But again, you've got to create those relationships first to get them to move.
Thank you. And I think relationships are really important. The other thing that I'm kind of hearing here is that there are things that we have learned from our work in CAR-T and oncology that we absolutely have to rely on when we are moving into non-oncology CAR-T as well. So thinking about those regulatory timelines and the extra things we have to do for import-export is something that we will have learned from that work we've done before. Thinking about sort of what the supply strategy is and how close you are to where the cells are being made, and whether you need to think about allowing time for tech transfer and all that kind of thing is another thing that we probably have learned from the work we've done before that we need to bring forward as well. Any other sort of roadblocks to starting new sites or extra steps that we have to go through when we're starting up sites, either sort of in non-oncology CAR-T or just in CAR-T in general?
And the one thing I do want to add is making sure those questions are mapped out. Again, have we asked all the right questions? And I will tell this to every team. It's not as straightforward as IRB, IBC. What other committees are there, especially outside of ex-US? They have so many more committees and so many steps. Again, plan that, ask those questions from the beginning, even if the site is unable to give specific timelines, know the roadmap, because that will set everyone up for success at the end of the day. And some of those nuances are in place because of non-oncology. I feel like there are a few additional layers outside of this because this is still considered so new, that there are additional committees and hands in the pot, so to speak, to get these studies approved.
I suppose sort of really robust pre-study visits is really important to finding out all those nuances.
Definitely agree with that, Louise. And I think that's why it's so important that you bring both the oncology department, non-oncology departments, even considering and asking if there are two different legal departments that need to be involved to have buy-in to participate in such a study. Also considering that you may have some responsibility agreements, who gets to be the lead PI, and if both of the oncologist and non-oncologists do want to be the PI, who gets to have the final say in being the named investigator? Or do you consider such a model as a co-PI model? All of those things, getting those discussions happening during the PSVs, really having a robust discussion is really helpful to the success of the study.
Rielle, and that sparked my memory on one thing to add when you talked about legal. I'm seeing this with ex-US pharmacies need their own, not every country, but some countries, pharmacies need their own financial agreements. So not only do you have the site-specific financial agreement, but their pharmacy also requires that as well. So that's an additional step as far as negotiations are concerned. And then to add on to that with having, who's going to own or be co-owned, again, making sure the right people are coming to the PSV and especially the SIV. I've seen cases where rheumatology was not necessarily, they were an afterthought. Well, they're going to drive most of this from these non-oncologies. They have to be a part of it. So making sure the teams are asking the right questions of who's going to be available, again, to pull everybody together as one.
Thanks. And then once you've set up the sites and you've found your sites and you've got all those responsibilities defined, and then you've got to go to the next step of finding the patients. How are you finding this in non-oncology CAR-T? It feels like a different space that we're moving in. Are the patients ready for these treatment modalities?
Louise, what I can say is currently, with the studies I manage, we're seeing actually a very high interest from patients in wanting to participate in these studies. So recruitment, while I would say it's not as aggressive as you would see with a traditional oncology CAR-T trial, it is not as pessimistic as one would expect. And so we've had really good enrollment so far. I think what's important is that we've had a lot of materials developed early on for patients and caregivers, and a lot of support in place for patients and caregivers to make it attractive for them to participate in the studies.
Yeah, and Erin, I think we've seen clients as well sort of reporting out their success stories to news broadcasters and that kind of thing.
Yes, which definitely helps as far as increasing the interest for anybody. And not only does it help on that end, I think it really drives our teams as well. The reason we do what we do is seeing these amazing success stories and what the drug has done for these patients and turn their life around. It really does make a true difference in my mind.
Yeah, I think so. I mean, I think it's really exciting to see such a new modality and a new hope for patients that perhaps have felt that they'd reached a baseline and they were going to always carry on like this. So it's really excited to being involved in something like that, and being able to share that excitement, I think, is really going to help us get more sites engaged and taking part in these kind of studies and get more patients involved as well.
Yes, agreed.
Thank you, Erin and Rielle, for sharing your experience and advice. A few key takeaways stand out. For sites, now is the time to think about how your institution can prepare for these studies, bringing departments together, mapping committees, and setting up infrastructure. If you're interested in joining Fortrea's Non-Oncology Cell Therapy Network, please do reach out to us. And for sponsors, remember, this is a competitive space. Start planning earlier than you would for oncology CAR-T. Allow time for tech transfer, regulatory approvals, and global logistics. These steps are essential to accelerate activation and deliver hope to patients faster. Thank you for listening to Hope in a Dose. Subscribe for more insights on advancing cell and gene therapies, and keep an eye out for further episodes of the Hope in the Dose podcast. I'm Louise Kearney. See you next time.